The Minnesota State Retiree Council is very concerned about accessible health care for all. And we have been chatting with Senator Matt Klein, who is not only a state senator, but also an internal medicine doctor at Hennepin Health in Minneapolis. So we've looked at problems with access to health care from a greater Minnesota point of view, as well as an urban point of view. Now let's look at solutions to accessible health care access. Senator Klein, what do you think?
Well, thank you, Dan. Thank you for the opportunity to talk about some solutions, because there are some great ones, and also for the opportunity to speak with your members. You know, I'm working with the other physician in the legislature, Republican Scott Jensen, on a drug price affordability commission that we'd like to pass this session, where we would have some authority as a state to look into price gouging or excessive prices on drugs, insulin, others, antibiotics, and investigate those and bring those prices down for the people of Minnesota if necessary. We need that kind of control over that industry if we're going to continue to provide affordable health care to our citizens. And the other thing is insurance costs. I think most of your members know that the price of health insurance is exorbitantly high in many cases. The deductibles are extremely high. Here at the legislature, I continue to work on a bill to pass a public option where we would have an insurance product similar to Minnesota Care that would be affordable and accessible to all Minnesotans, so that they would have an affordable alternative to buying their health care, say, from Blue Cross or from Medica. And I'll continue to work on that. We talked specifically earlier about how it's hard in rural Minnesota in particular, because physicians, tend to not practice there, and there are deserts where there's not health care available. The legislature continues to work on loan reimbursement programs to encourage physicians to practice in rural Minnesota, and those can be more robust. But more modern and more important, Dan, is we're working on telemedicine options to practice health care all across the state, Alexandria, everywhere, out of a central location, perhaps here in the metro. And you can do that by telemedicine. It's been proven effective. Proven to improve outcomes, and I think it's a good option, especially as Governor Walz expands broadband access across the state. We can do telemedicine. And lastly, Dan, statewide, we need to work on our transportation system. Elderly people, disabled people, retirees have trouble getting to their appointments, whether they live in Duluth or in Minnesota or in St. Cloud. And we need more. We need more and better highways. We need more and better transit opportunities in the metro and statewide, so that people can get to where they need to go. And that's part of the healthcare solution.
Okay. The concerns we have are statewide concerns. It's not, we're not just concerned about rural areas, not just concerned about urban areas, but we're all in this together. And and it's not just healthcare, but it's tied into transportation and other factors. So Minnesota AFL-CIO looks forward to continue to working with you as we tackle this very vital problem. Thank you, Senator Matt Klein.
Thank you so much.